Everyone, my name is Dr. Jasim. I am an interventional radiologist in Maulana Hospital, Perindalmanna. So today I'm going to discuss about something that's of much concern for most people. It's what's called thyroid nodules. So this thyroid enlargement of the times, the lesions are or the thyroid nodules are more often than not they are benign. That means they are not cancerous in majority of the cases. So the generally the protocol is that many of these lesions may not require a surgery. So, in such cases, we do an ultrasound of the thyroid gland or a high resolution ultrasound of the thyroid gland and looking at particular imaging characteristics. For example, the appearance of the nodule, the presence or absence of small specks or bright dots within the thyroid nodule, and the vascularity or the blood supply of the thyroid nodule. Based on different imaging characteristics, we are able to characterize these lesions into different types, and we can say that they are most likely to be benign or most likely to be malignant. The malignant one being, of course, we are more worried about the malignant types of thyroid nodules. So, having done that, we can do a test in what's called an FNAC, or a small, in which a small needle is inserted into the thyroid nodule, and after removing a few cells from the thyroid nodule, we can look at it under the microscope and we can determine what type of lesion it is, if it is actually a benign lesion or if it's a malignant lesion. So when if it's a malignant lesion, definitely it would require a surgery based on what type of malignancy it is and how much of the gland has to be removed and so on and so forth. That has to be decided with a surgeon. Whereas if it is a benign lesion, if it's a small lesion, we can just let it be and we can do a follow up scan after a couple of weeks or months and see if there is an increase in size and so on and so forth. But if it's a benign lesion and if it is causing significant disfigurement, or if it causes compression of the trachea, of the windpipe, and causes difficulty in breathing, or sometimes if it causes difficulty in swallowing, in such instances, we have traditionally what we used to do was to do a surgery in what's called a hemithyroidectomy, or we remove part of the lesion or the entire thyroid gland based on what is required. But at the moment, with the advent or with the improvement in interventional radiological techniques, what we can do now is what's called an ablative procedure or an ablation. Now, ablation means burning of that tissue. So we can use what's called radio frequency waves, an RF ablation, radio frequency ablation, or a microwave ablation. And using that, we can shrink the size of the thyroid nodule and make it small enough, or even in certain instances, we can remove it entirely just with the help of a pinhole without removing the thyroid gland per se. So this has a particular sense of, I mean, this has a particular series of advantages over the conventional treatment, that is the surgery. The first being, this is a pinhole surgery, and because it is a pinhole surgery, we do the procedure under local anesthesia. That means we just numb that area of the just over the skin and just around the thyroid gland. We numb that area and then we do the procedure, and because of that, the patient doesn't have to undergo a general anesthesia or a higher a sedation and so on and so forth. Many a times when I do the procedure, I talk to the patient repeatedly while doing the procedure, and that makes them more comfortable during the procedure. And also, because it's a pinhole surgery, it is done as a day care procedure. That means after doing the procedure, we wait for a couple of hours and the patient can go back home the same day. The other advantage is, the major advantage is, you can avoid an unsightly scar, and this is just a pinhole, and many a times it is minimal. You can just see a dot, or many a times even no scar at all. So this is essentially a scarless procedure. So with that, again, with the being a minimally invasive procedure, there's less chance of hospital acquired infections or infections in general. or there is even less chance of any complications. This has a very, very, very low rate of complications. The other added advantage of a minimally invasive thyroid procedure like an ablation is that we are essentially saving much of the thyroid tissue, and because of that, the patients do not generally require a hormone replacement therapy. Another major advantage of this procedure is that since we are essentially leaving behind the normal thyroid tissue, the patients do not require a hormone replacement therapy lifelong. So these are huge advantages of the newer thyroid ablative procedures over the conventional procedure in what's called a thyroidectomy. And there are also additive procedures in what's called thyroid embolization. That is, we go into the artery which is supplying the thyroid gland, and we can deposit small particles which can essentially shrink the thyroid gland. So that's about the newer advancements or newer procedures in the with regards to the thyroid gland in interventional radiology. So if you'd like to know more about these procedures, and if you have a thyroid issue, do make it a point to consult your interventional radiologist also, along with your endocrinologist and your endocrine surgeon, to know about these procedures. Thank you very much.